far as prognosis, over the last 5 years, there have been multiple scoring systems that have been developed where you can use clinical information and laboratory information to assign a patient to a risk category, and that risk category will give you some way to estimate what kind of outcome the patient will have. And some myelofibrosis is very slowly progressing and does not need a lot of therapy, and some myelofibrosis is very quickly progressing and should be treated more aggressively up front. So that was number one, assigning disease risk score. Number two was assessing the symptom burden. The goal of treatments like ruxolitinib and other treatments for myelofibrosis is to alleviate some aspect of the symptoms that the patient is having, and using a tool that's developed to completely classify the symptoms that the patient is having can help you to know that the treatment you're using is efficacious, or whether or not you might need a new treatment as well. The only way to have it to where the patient can put the disease behind them is to do an allogeneic stem cell transplant from a donor, where the old blood system is taken out with chemotherapy, and stem cells from a donor are infused, and they constitute a new blood and immune system. It's a risky therapy with some side effects, but in the right patient at the right time, it is a therapy that can get rid of the myelofibrosis, alleviate the myelofibrosis, and there's a substantial amount of patients that do well with that therapy. But the procedure is too risky for some patients, so factors like age and other diseases are very important when deciding whether or not to choose transplant as a therapy.